after the abstract keywords, so usually 2 to 3 keywords, indexing and easy online retrieval. So for online retrieval, again, it is important. As in ResearchGate or in other Google Scholar, it gives you that how many times your, or citations, for future citations, or increase your impact factor as an author, your keywords, your abstract, and your title. These 3 things will be the criteria which will come up for when people are searching for a certain thing. So your focus should be on these. Of course, focus should be on the whole manuscript, but predominant focus should be on these 3 things. Then introduction. Few of the journals ask for introduction for a case report, few do not. And I would suggest that, once writing a case report, similar case reports, or once you identify that which journals you have, shortlisted in your research, that where you want to or you can publish those case reports, you should read already published. May those be for other subspecialties, may those be not concerned with your subspecialties, but try to read at least 5 to 6 case reports in the same journal, or with of the same of or maybe similar uh, content. So at least 5 to 6. For original articles, they say that at least you should read around 10 to 20 articles around that, and then gather the references and gather the content, or how to present that. So describe the uniqueness of the case and how the case contributes to the existing literature. So that would be the introduction. But for some journals, for the case reports, the introduction is not there. But original articles usually they do ask for introduction. Then case description and summary. So this is the main focus. So it should be presented in chronological order. So people sometimes they don't know that how to present a case. Chronological order means that the history, like we do the physical examination, so we go and we introduce ourselves, and then take the history, and then examination, and then investigation, and differential diagnosis and management and follow-up, and then final diagnosis. Exactly how you should present a case. For histopathology, what we can do is that very brief clinical presentation, because that's what we get with the specimen, then macroscopic description, then microscopic description, additional workup if you have done, and how you reach the diagnosis, and then very nice pictures. And then you can say that it was, if it is a tumor case or if it is a skin case which was discussed in MDT or any meeting later on, then you can say that it was discussed and that was the treatment options provided to the patients. Or if it went for molecular studies, and so I'm just trying to focus for histopathology over here. However, for the clinical and other, it's like from the start, chronological order, and just enough detail for the reader to establish their own conclusions about case's validity. So it should not be too much details, but it should not be that brief that the reader should just lose the interest. And then all important negative findings, just like how we write, a histopathology report, that we have excluded this, and why we, reached a certain diagnosis. Our Again, this is important, that our own interpretation or inference should be avoided in this. That I think, I feel, or we think, we feel, or we have suggested. No, it should be based on evidence-based medicine. And then tables and figures should be used to reveal chronological findings or to compare the observations using different methods. I would say that again, for me as a reader, tables and figures actually, figures and pictures are very, and illustrations are very helpful. I'm not sure about others, but human beings are, we are pictorial animals, and we try to see, and then other things come. So if a person, they say that if a person is frowning and they're talking very sweetly, you would see their face and their expressions, and then you won't hear the words or get the uh, uh, get the feeling in the heart that, oh, this person is very nice or friendly. You will see what's on their face and the expression and the tone of their voice, and then you will maybe just, cut off. So over here, just like that, the present the our publications, now the pictures and illustrations and figures, sometimes they catch our attention. Those are the first things. And then figures need the a brief and clear description. Now you see the Google search and other search engines, they go for image search also. So again, this is important for retrieval, for online retrieval of your case report. Why I'm stressing that much for the online retrieval is that your citations in the Google Scholar and in those, your how many people have read your research or case report, that will increase your impact factor as an author. And then abbreviations. So I'm not sure if people know it already, but in always in a publication, first time when the abbreviations are used, they should be defined. And in the brackets, the abbreviation should be written. And then later on, you can use only abbreviation. And please never use abbreviation in the titles should not contain, an abstract should not contain abbreviation. Then discussion part. So after the presentation of a case, then discussion is finally scientifically, or the people who are of similar subspecialty, the discussion is the most important section. And then it summarizes and it interprets what are the key findings for the case report. And then you can compare and contrast what's already known and justify the uniqueness. And then this discussion part is like you can use it for to derive new knowledge and applicability to the practice and clinically useful conclusions. And it's not for the case report, it's not designed to provide a comprehensive literature review and the citation for all the references and everything. So therefore, in the case report, the references should be very critically evaluated. In the original article, it's more detailed. Of course, you have got more word limit and you have to ask about different things. And then limitations of a case should be stated if there is any. And the value, which again, that is just a repetition, that whatever the case is adding the value to the current literature should be highlighted. And then towards the end, references, and it should be, I think, some of the journals ask for 5 references for the case report, some ask 10, and some ask 15. So I would say that try to write a brief outline and then go for, and then towards the end, I will just let you know that how it helps me to go for the journals that where I can publish. And I might do a separate presentation on that also, that how to select a journal for your publication. So target audience for the case reports, usually it's a specialty journal and not a journal, And then open access versus subscription based, because usually subscription based will ask for a publication fee, usually. And it all depends. And sorry, usually open access will ask for a publication fee, and subscription based can sometimes publish for free. And then review journal guidelines before submission. So what I do is that I select at least two, three, four, because the rejection rate is there, and you should not get dejected after rejection. I have got one for one article, for one of the original research. I think it got rejected from 3 or 4 journals, and then it was published finally in an impact factor of 3.4. So yeah, Divya, I might do one more, presentation for journal selection, that where to, how to select the journals. I have become a bit kind of a initial period in the change of job. In 1 year, I have published 13 PubMed indexed publications. I think it was 2013 or 2014. So it's not a difficult thing to do, but you should know that what you are going to publish, and you should know that what's your target audience and which journal you can publish. And about audits also, it's not difficult at all. You what Again, depending on what's your audit findings, and again, please publish, please try to publish your audits. Why? Because one thing is that, of course, I always say don't publish for the sake of publication, but it will help others also. Because what's the purpose for doing audit is that quality assurance and quality enhancement. And sometimes we do an audit, and for certain things, it's very strange that you don't find some guidelines. I can talk off the record for that, but I was surprised that I was searching for one of the questions, for one of the recommendations, or something 2 days back, and I could not find it. Then I had to search wider on a wider aspect, and then finally I found something. uh, it was like related to digital, so maybe it's a new thing or those things. But if for digital we are doing audit, if for anything we are doing audit, so I think please publish. And I will, towards the end, I will let you know how to go for about the journals in which you can publish the articles and in which you can publish the audit. But audit findings are very important, again, to get published. And that's what I say, that I have done, I think, two or three, and those are one already published, one is in the process of manuscript write-up, and the third one we have just started, and I'll try to get that published also. And literature review, this is again one of the important things. And for your audit also, I would say that this is one of the important thing, that what's already there. So what usually is the case is that the journal who has already published, which has already published a similar article, will not publish again the same. So you have to find another. You have to find a different but similar journal. And then common mistakes to avoid in case report is that lack of patient consent, then poor organization or too much detail. Then these are the final tips, and just the meeting time is being finished, so I'll just quickly go through that. And conclusion is that focus on clarity, novelty, and ethics, because case report is can lead to a patient identifiable thing. So you have to be much more careful with the case report. And then why to publish? I say please publish. Whatever, like you said, a very nice question, Divya, that audit. So please enrich. And this is why to publish. This was an case report which was published in 1981. And this was the first case, presumably, which was later covered 1989, from where I took the article, that it was AIDS. So if they had not presented or they had not published, the things might have gone unnoticed. The skin manifestation or dermatological manifestation of AIDS. So this is one of the journals which is like, its name is Journal of Medical Case Reports. I have published in that also. I think it was one of the new, it was, for me, it was one of the journals where I published in my initial time. And then these are the database to search for, that your case report is really novel. It's not a repetition of already known thing a lot. So up to date, PubMed, and cases database. So these three you should say. This is the one which I was saying, that Schemic Go journal and country ranking. So highly ranked journals are, case reports are difficult to get published in these. And the key is that public, if it's kind of slightly more common thing, then try to go in those for those countries or regions where it is uncommon. Those will accept usually. So I think I will go for that how to select a journal for your publication. I'll do one brief presentation on that also. Yeah, for references, again, very good question, Divya, that for references, it depends on journals. Usually it's Vancouver, but it can be different. So the journal will give you the in the guidelines that what is the reference style they want. But it's very easy. If you go to the PubMed, you go to the site, and site tab will give you in different types that you want it in Vancouver, you want it in something else. So it will give you the reference and citation. Very easy. It's quite easy now. And